For months, they were telling us nothing was wrong, but as a mother, you can tell when something isn't right with your child. Eliana's twitching kept getting worse, yet every time we did an EEG scan, nothing would show up. I wanted a second opinion, and finally, at 4.5 months, Eliana was diagnosed with Dravet syndrome. I wish I could say that's when things turned around, but it was actually when her symptoms got even worse. It wasn't until we started on Diacomet that we finally got some relief for her and our family.
Diacomet is the only FDA-approved anti-seizure medication developed specifically to treat seizures associated with Dravet syndrome in children as young as 6 months, 15 pounds or more, and taking clobazam.
Eliana was born in October 2019, and for the first 2 months she was healthy and growing just fine. But after we went in for her 2-month checkup, I noticed her arm was twitching later that day. When the twitching wouldn't stop, we took her to the ER, where they did a full spinal tap, but they didn't find anything. We went home, but I kept noticing the twitching and uncontrolled movements, which started to show up all over her body and not just her arm. We took her back to the ER, and this time they did an EEG scan. They still didn't find anything, but the twitching and spasms started happening more often. At bath time, just a touch of the water would cause an episode. I knew that wasn't normal, so I started recording everything on video. Our pediatrician referred us to a neurologist who did blood work and conducted MRIs, but still told us nothing was wrong. I wanted a second opinion. So I took my recordings to a different hospital, where the doctors did another full workup. Again, the EEG seemed normal, but this neurologist agreed that Eliana's behaviors on the recording could be seizures. He offered to do a genetic test, which included screening for the SCN1A gene mutation that is associated with Dravet syndrome. I got a call to come in immediately for another EEG. She had the mutation. Knowing her genetic history, the doctors detected small discrepancies in her brain activity, and she was diagnosed with Dravet syndrome. Even though we finally knew what was happening, instead of getting better, it's actually when her seizures became more frequent and intense. Getting a proper diagnosis was great, but that was only half the battle. Because Dravet seizures can be really resistant to medications, we had to keep trying different ones, with some making her seizures even worse. I think we tried at least 5. Sometimes they would work for about 3 weeks, but then seizures would start back up again. Eliana was having prolonged, full-body, tonic seizures, with the worst one lasting 3 hours. Her development was regressing, and by the time she turned a year old, she had been intubated 4 times. Seeing your child suffer like that is so scary. Not only was my daughter hurting, but the entire family was consumed with hospital visits. All we could do was keep looking for the right treatment. We heard about Diacomet early in Eliana's treatment journey. Her doctors were optimistic about it because they knew it was developed specifically for Dravet seizures, unlike some of the other medications we had tried. But she was too young. At the time, it was only approved for children 2 years and up. But in Eliana's case, since none of the other anti-seizure medications were working for her, our care team pushed to get her access to Diacomet earlier. And at 1.5 years, Eliana was able to start Diacomet as an add-on therapy to clobazam, and it made a huge difference. Since then, she's had fewer prolonged seizures and unplanned hospital visits. Every time she had a prolonged seizure and was hospitalized, we just didn't know what was going to happen. We couldn't make weekend plans, and I was scared to plan her birthday party because we never knew when we'd be back in the hospital.
There are also risks for use of Diacomet. The most common side effects are sleepiness, decreased appetite, agitation, impaired coordination, decreased weight, decreased muscle tone, nausea, tremor, slurred speech, and trouble speaking.
Seeing the progress that Eliana has made on Diacomet has made a meaningful difference for our family. We have better control of her seizures now. I know so many families are going through the same situation. Even after getting the right diagnosis, finding a treatment that works can be tough. Having Diacomet available for kids as young as 6 months is huge for our community. It can help little warriors like Eliana get effective treatment sooner. Talk to your child's doctor about Diacomet because for children with Dravet syndrome, reduction in seizures is possible.
Indication: Diacomet steripental is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam who are 6 months of age and older and weighing 7 kilograms or more. There are no clinical data to support the use of Diacomet as monotherapy in Dravet syndrome. Important safety information. Contraindications. No contraindications are listed. Warnings and precautions. Somnolence. Diacomet can cause somnolence. Monitor patients for somnolence, particularly when Diacomet is used concomitantly with other CNS depressants or clobazam, which is also known to cause somnolence. Decreased appetite and decreased weight. Diacomet can cause decreases in appetite and weight. The growth and weight of pediatric patients treated with Diacomet should be carefully monitored. Neutropenia and thrombocytopenia. Diacomet can cause significant declines in neutrophil and platelet counts. Hematologic testing should be obtained prior to starting treatment with Diacomet and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, or AEDs, Diacomet should be gradually withdrawn to minimize the risk of increased seizure frequency and status epilepticus. Risks in patients with phenylketonuria or PKU. Diacomet for oral suspension contains phenylalanine, which can be harmful to patients with PKU. Before prescribing Diacomet for oral suspension to a patient with PKU, consider the total daily intake of phenylalanine from all sources, including Diacomet for oral suspension. Diacomet capsules do not contain phenylalanine. Suicidal behavior and ideation. AEDs, including Diacomet, increase the risk of suicidal thoughts or behavior. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Adverse reactions. The most common adverse reactions that occurred in at least 10% of Diacomet-treated patients and more frequently than on placebo were somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia. Pregnancy. There are no adequate data on the developmental risks associated with the use of Diacomet in pregnant women. Based on animal data, Diacomet may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to AEDs such as Diacomet during pregnancy. Physicians are advised to recommend that pregnant patients taking Diacomet enroll in the North American Anti-Epileptic Drug NAAED Pregnancy Registry. Information is available at www.aedpregnancyregistry.org. This can be done by calling the toll-free number 1-888-233-2334 and must be done by patients themselves or their caregiver. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full Diacomet prescribing information at diacomet.com.